feeling great. Welcome back to the meditation special series on Light of Knowledge. We will continue our discussion with doctors because there are some questions which have not been yet answered. It has been said that when you treat a disease, sometimes you win, sometimes you lose. But when you treat a person, you will win no matter what the outcome. To answer these questions for us, we have with us in our studio once again, Dr. Donika. Dr. Donika, welcome to the show.
Thank you. Om Shanti.
I would like to continue the discussion where we left off last time. We were talking a little bit about insurance, and you related your experience where the first thing after you enter the hospital, you are asked for medical insurance. How does the greed factor play into this health system, whether it be a hospital or a private clinic?
It's a very interesting thing. And today what we are seeing that the multi-speciality hospitals or the hospitals which have been made up, sometimes there are targets kept that we have to complete this much target, and many of the times it happens that it has been said that you have to complete this much targets. We have brought new machine and it should be utilized, or else what's the use of it?
Okay, so indirectly the patient is paying for the new machine.
Yeah. So it's a very, you can say, deeper aspect. But we need to know that the tests which the doctor is prescribing to the patients, if it really is needed, then it's ethical. But if it's not needed and still we are just advising that you have to do MRI, you have to do CT scan or any of the tests which are still not needed, and we are telling or advising the patient to do somewhere or the other, we know we are not supposed to do and still we are doing it. Here the thing comes that the patient and his relatives, each of them are paying their hard-earned money, and how much of their wishes, you see, in that aspect, when they come to know it's not needed and it's done, or the doctor himself know the bad wishes, what we call in Hindi as baddua, that bad wishes that come out, that really affect the doctor, as well as we see the atmosphere, environment and the persons associated with it.
Right, because many times, like I said, as an educated patient, when we walk into a doctor's office, many times even we ourselves can know that, especially I have some medical background, maybe this test is really not needed for me, but when a doctor says you have to do it, then you don't have a choice, you just go ahead and do it.
So meditation teaches me that I, as a doctor, I now know that the patient is trusting me and coming to me. That is a very important word, trust and faith. When he trusts on me, when he has a faith on me that I am in safe hands, I have to give myself the same introspection that now I don't have to cheat patients. I don't have to do for my earnings or for my targets. I have to do what is ethical for my side, and meditation gives me a line on it. I would like to narrate an incident of a boy who was needing even food badly. Once he was so much, you can say, starving, he was needing food badly, and he entered a restaurant. The restaurant person, the restaurant was very small, you see, but the owner of that, he understood the feelings of that boy. He had that empathy because he knew I had come out of those situations. He offered him the milk. The boy just looked at him and said, I don't have money for it. He said, you don't need money for it, just have it. I know you need it. He drank that milk and he had so much, you can say, duas or good wishes for him. Years afterwards, the person who had given the milk to that boy, he had a very severe medical breakdown, and then he was admitted to the hospital. He was having only one girl, and the girl was like, he was very shocked, depressed. What shall I do now? I don't have so much of earnings. I don't have so much of amount to pay the bills. So she thought of selling the restaurant what she was having.
Oh, okay.
But one thing, when the bill was into the hands of the daughter, it was written downstairs, the amount was written, and then the doctor had a sign and the remarks were written, paid in full with 1 glass of milk.
How beautiful. What a touching story. I mean, this tells you like one small gesture, and it's not really small, but we think of it as small at the time. So one small gesture can go such a long way. Oh, what a beautiful story. I like that.
So here, what the thing we learn from this, that we are doctors, not machines. And when we come to know that we have to take a feeling of compassion for the patients, there we give a human touch.
That's right.
So what in Brahma Kumaris or the meditation, spiritual meditation, what we are learning over here, we come to know many of these aspects through the 4 subjects. First is with meditation, meditation is one of the important subject because knowledge we all are having. Today we all know we shouldn't get angry, we shouldn't have greed, because this greed concern, it's for me to stabilize my standards of living. I as a doctor should have this car, this much of, you can say, bank balance, this much I shall go for a you can say outing for this and this place.
I'm sorry to interrupt, but when you say angry, you touched upon 2, anger and greed. So when a doctor goes into anger, I mean, that is a first obvious thought that comes to mind, that a doctor should not get angry at his patients. But what are the causes that would, bring a doctor into this feeling of anger?
The feeling of anger, again, it comes from where? When I sit myself and I try to initialize those days when I was doing my medical, you can say, internship, I used to see many of our professors, they used to get angry at each a very silly aspect, that if this thing is not done, oh, he will be so much angry, he will call the ward boy, he will just shout the staff. And now the staff is like, oh, today the doctor is very angry. Don't even dare to go in front of him.
Oh, I can just imagine the kind of anger waves it sends all across, down to the ward boy.
Yeah. And now the thing comes, this anger, the doctor or the person thinks that it is because of him. But let me ask myself, isn't there another perspective from which I can treat the same situation? The same situation, if comes to other doctor, he may not react in the same way. He may not shout. He may just go into his cabin, call into the receptionist and say that please check out these things. They shouldn't happen again. They shouldn't go back again. So now the receptionist could also have handled it, and there could be no shouting or no anger atmosphere what was created in the hospital due to it.
Right. I was just thinking, maybe is there any kind of power issue with the anger? Like if the doctors comes in angry, and maybe that is to make his people respect him, or could that be one aspect to it as well?
I think this is a misconception, because what we used to think initially, that anger is my power, a tool. If I shout, if I get angry, the other people will just listen to me. But just going back, if we as a layman go back to those persons and try to find out his feelings for that doctor, he would of course transmit a negative energy. He would be like, oh, he's shouting so much, he's an angry person. See what tags or labels we are getting. Now, meditation, it gives me a touch that the situations will come around me. The same situations which made me angry initially, as soon as I now know that I am a peaceful soul, what discussion of the soul aspects we have done in previous or introductory session, as soon as I realize that I am a peaceful soul, and these situations whatsoever coming, I may think it wrong, but the reaction of mine as an angry person, the situation will make it more worsen. Rather, I will also be in the wrong situation by getting angry.
Yeah, actually, I can even see how if the doctor does not get angry, I think his practice will even flourish, because he'll get more patients. Because see, even with doctors, it's word of mouth. I will refer this doctor to you, my friends, relatives. Like, I went to this doctor, I had a great experience, he helped me out. So not getting angry is also going to be something which is going to help him with his career.
Definitely. Here, when we have a positive energy, when I have a positive energy that I am a peaceful soul, and then I start treating the patients, I'm passing that energy of peace, I'm passing that energy of happiness, You realize when you enter into the cabin of the doctor and he is angry, shouting at the ward boy, why didn't you get this? Why didn't you get this? And instead of that, when the patient is entering and the doctor greeting him with smile, greeting him and his relatives with smile, that hello, how are you? And just making the atmosphere light, of course, the patient would definitely love to come to the doctor who is having a very positive approach.
Right. If this were to happen, if I'm sitting in the waiting room in the clinic and if I'm hearing some shouting going on, I would probably leave. You know, if I'm not in much pain, I would probably leave.
Yeah, of course. And that brings me to the conclusion of this aspect, that it's not anger that is my tool, but it is my weakness. But when I add myself as I am a peaceful soul, it's my elevation, and that's not my weakness now, it's a power. Getting angry is a sign of a weak soul, and getting a pace of peace is a sign of a powerful soul.
Absolutely true. But I was also wondering, all this stress and anger and frustration that we're talking about, could this possibly be because of the ratio, you know, the population to the number of doctors we have available? And does that put the doctors under a lot of stress? Because even they have, whether they're working for a hospital or their own private practice, you know, there are like, say, 20, 30 different patients sitting out there. And nowadays, doctors also do practices in different clinics, different hospitals. So this clinic, I'm here today, in the afternoon, I have to go to this other clinic. So can the ratio of a doctor-patient ratio can also be responsible for this?
Well, research has shown that in India, there are 50 million people who are depressed today.
Oh, boy.
Now you can understand that these 50 million people are only the recorded ones.
Yeah.
And when this concern was brought out by one of the Indian president of Indian Psychologist Association, and what we can perceive is only the patients are only the ones who are depressed. It's not that. Even the doctors are depressed today.
Yes, that is true.
And so when I say that the ratio of this proportion, when the doctor himself in that proportion, what healing energy can transmit to the patient.
That's right.
If the doctor is treating 40 patients in a OPD, and he thinks, oh, that's enough for me, and one more patient enters, he would transmit such a negative energy to him that, oh, I have to see one more. This negative energy, what I have done for the 40 patients, will transmit all through a wastage.
Oh my God, is that really true?
Very true.
One negative energy at one patient is going to wipe out the 40 good things that you have done to 40 patients earlier? Really,
because I, as a doctor, not only give a physical healing, but a mental healing, or you can say psychological aspect of good vibrations to that patient. I really wonder, sometimes the patient comes, he may not be having any disease, but he just wants a counseling. Even sometimes we see the doctor, they prescribe placebo to the patient, but the patient with the follow-up, he has a very good result. Why is it so? Somewhere or the other, the patient just needed a smile and a counseling and just a word, you will be fine, you will be okay, nothing to worry. So I, as a doctor, have a very wider role in the society. I have to transmit a positive energy.
That's right. One thought that came to my mind, doctor, since we're discussing the different scenarios, doctors do have to work late nights. They're on call. And this kind of disrupts their diet. This will also disrupt their family life, their social life. In addition to the salary that they get paid, they do have to deal with all these pressures in their life. And that can also add up to all the stress and anxiety in their life. So this brings us back to the fact that you were explaining that meditation can help them in a big way.
But how can meditation help? That's the thing which we want to perceive. Body has his own needs. He needs food to be eaten. He needs the food so that it can give the energy to the body. But the thing is, when there are patients, when there are emergencies, this schedule may be haphazard, or this schedule may be the schedule may go up and down with the doctor. Now, when the doctor has the feeling that, oh, I have to take the lunch and I am to see the patient now, he is transmitting the negative energy. Meditation helps me to give a pause within myself. Okay, the patient needs me more now. The food can wait a bit.
How wonderful. So this is such a beautiful, noble thought.
And once the thing is sorted out, now I relax and I give a positive vibration to the food also. Before getting it started, I just radiate a positive thought that now my body, now as a soul, I'm getting this fuel to the body.
That's very nice. So it's like I satisfy the patient first and now I satisfy my hunger.
And while satisfying my hunger, I put my mind at a thought of elevated level.
Okay. For example?
For example, initially I used to think, whenever I was having a very busy schedule, I used to think I have to finish up the food and now again I have to do this, do that.
That's what we normally think.
Yeah, that was what we were normally doing. But now when we are in the journey, or we are on the journey of meditation, when we are to do those things, see, we are doing those things only, but we are doing with a different attitude.
I think that is the crux of the matter.
Yeah.
We are not changing anything outwardly. We continue doing the same things as we were doing before, but our attitude has shifted.
Yeah. I, as a soul, am a peaceful soul. I have to take this food and again I have to go back with my work with a peaceful manner, with a peaceful energy. So when I have this change in my attitude, I will see that the stress which I was getting initially, what you called that it may transmit in the form of anger, in the form of depression, in the form of stress, but the change of attitude, the change of thoughts, it will make me connected with the higher source, that is the Supreme Soul, Shiv Baba. And when I am connected to the Supreme Soul, Shiv Baba, I am doing all the works, but with it I am meditating. With it I am remembering Shiv Baba, and this will add up energy to me.
Actually, you know what? This sounds like an extremely wonderful process, which is not only wonderful, but is going to give good results. Because I was just thinking, a lot of times doctors get hit with malpractice lawsuit. And if doctors took all these precautions that you are talking about, or tips, if I may, then why does malpractice lawsuit happen, according to me, where the patient is not satisfied in some way or the other? So if the doctor takes all these precautions and if he keeps himself centered that I am a soul helping my patients, then I think all the lawsuit will probably be cut down by a great %.
Oh yeah, that's a very noble thinking. If all can bring upon that, when I was doing these practices, if the doctor comes to know that I was doing these practices initially, but now he is on the consciousness that whatsoever I am doing, I will get it back. The energy will be transmitted me back.
Okay, so we are talking about karmic law here.
Yeah, karmic law. Whatsoever I am giving, I will get it back. If I am giving negative energy, if I am making others in a sequence of pain, the same pain will get radiated to me, it will get transmitted to me, and not only to me, but the persons who are associated with me, with my family too.
Oh, okay.
Because this transmission makes me more painful. Now I have to reconnect myself. Oh, if I go to these practices, it will definitely ruin me up and unstabilize me. Instead of that, now I have to concentrate on my ethics. I don't have to do those practices because it will definitely affect me.
That is very good to know.
And you will be astonished to know that I was just reading one of the, you can say, stories of a doctor. And he was not believer of the God initially. He didn't believe the God and all. But the thing what made he believe God was really a good one. He never believed God and he wanted to go to a conference, an international conference, and he was to go with flight. There was a connecting flight through which he had to catch the another flight. He had landed on the airport. Now he had to go to the connected flight. He had to go with the connected flight. But the atmosphere suddenly had a very great change. The environment didn't support it, and there was an announcement that the flight is delayed. He had to connect with the connecting flight. When he landed up, he came to know that the connecting flight which was there, due to the atmosphere not supporting, or the environment was not good, that has been cancelled. So he was already running out of hours. So he thought he should better have a private vehicle and move fast. And he took that private car. Again, the atmosphere was so very bad, the stormy weather, that when he was traveling, the road was very lonely. But he saw a house over there, and he thought that I shall have some rest, or I can ask for some help to rest over here, because the atmosphere is not supporting. He went into the house, and the lady, she received him very well. After giving him milk and all, the doctor was sitting, and the lady went into a room where she was praying God that to make her child from patient to a healthy one. When the doctor heard him, he asked her, what's the problem? And the lady narrated that I prayed to God that I want this doctor to come and take care of my child. And
Okay.
you would be astonished to know that the lady to which doctor he was referring, he was the same doctor.
Oh my goodness, isn't that something?
It's very, very true thing, and we come to know with that. The doctor was also now astonished. He was surprised that to which God he didn't believe initially, that God has answered this lady.
Her prayers.
Yeah, so he is over here, and now this teaches us that meditation transmits both positive energy, as well as we can get that positive energy. And the law of karma teaches us, if I am giving negative energy or if I am doing anything bad for others, that will be transmitted to me again and again.
Thank you very much, Doctor, for this beautiful discussion. And you have answered a lot of our questions today, and I'm sure our doctor friends out there have benefited from this conversation. We will continue this meditation special series, and we look forward to having you again.
Thank you. Shanti.
Today, our doctor friend has explained to us in many different ways how just stepping back a little, and before we start our practice, just stepping back, taking a 2-minute gap or 2-minute downtime, we can send positive vibrations to all our patients and our staff and nurses. We are treating not only the patient physically, but we are treating the whole patient, which means the body and the soul. And not only this, we are also affecting, as a doctor, we are also affecting his relatives and his friends who accompany him. So I hope these techniques that doctor has talked about has helped us in getting a better understanding of how we can do things differently from the way we were doing it before. She has talked about anger management and stress and how to deal with these pressures in a doctor's life as well. Hope you've been benefited from this conversation, and we look forward to your feedback. So thanks for watching us, and we'll see you again.